All right, well, it is 10:30, so let's get starting with our burnout and self-care working in the harm reduction field. This session we know that harm reduction is a set of strategies that meet people who use drugs where they're at, while harm reduction programs evolve through the efforts of grassroots community collaborations to policy change. Burnout is inevitable. So this session is going to be discussing the reality of burnout. Professionals in this session will advocate that self-care is not selfish and provide tools to aid in mental health. And so I just want to say that we have a powerhouse pack of wonderful human beings here. And I'm actually glad that we're not all in the same room, because the amount of experience that you all have would literally just like explode it. So I'm going to start going through introductions, and I'll try to go super quick because I know that the content is really important. So first, we have Jessica Miller. Jessica is a licensed professional counselor and certified advanced alcohol and drug counselor, a woman in long-term recovery, and someone who has worked in higher education for 20 plus years. After graduating from Oakland University with a master's degree in counseling, Jessica currently works for 1017 Recovery Network, where she is the community engagement manager for Isabella County. And she also works at Collegiate Recovery, supporting collegiate recovery, education, and wellness programs at Central Michigan University, Ferris, and Mid-Michigan College. So welcome, Jessica. We have Tanagra. Tanagra was born and raised in Puerto Rico, and she is the proud daughter of Mexican and Cuban immigrants. She also has over 20 years of experience in the field of organizational and program development, evaluation, technical assistance, community organizing, and direct service with underserved, oversurveyed, stigmatized folks, particularly within the Latinx communities. She currently holds the National Learning and Engagement Strategist position at Harm Reduction Coalition. Before moving to Oakland, California, she was working in Puerto Rico, and her work focused around women who are survivors of gender-based violence, working a lot on activism around the economic and human rights of women. Finally, Tanagra identifies as an intersectional feminist who believes in decolonization as the way towards liberation. So welcome, Tanagra. Thank you. Next, we have Renee. Renee is a community engagement manager, outpatient therapist at 1016 Recovery in Clare, Michigan. Renee received a master's in social work degree from Wayne State University and a BSW through Saginaw Valley State University, certified alcohol and drug counselor and certified clinical supervisor, and also certified to lead Batters Intervention Program. Renee has provided domestic violence expert witness testimonies in multiple courts throughout the Great Lakes region. Renee also worked as an advocate and a therapist since the late 90s. Welcome, Renee. And last but not least, we have Sarah. Sarah is an LMSW, has worked in the public mental health system for 20 years. She has been employed at Community Mental Health for Central Michigan since 2006. Sarah is currently the program director for Clare and Gladwin counties. She is trained in the evidence-based practices of DBT therapy, cognitive behavior therapy, trauma recovery and empowerment, parent-child intervention therapy, parent management training, and trauma-informed cognitive behavior therapy. Since moving into management, Sarah has worked to bring improved awareness to secondary trauma of her local offices and her agency. So, welcome everyone. Woo, I'm winded. you all, like I said, there's a lot that you all have to offer. So let's kick it off with our first question. How do you support your staff, your team at your agency, and how does it differ between hourly and salary employees? Whoever wants to go first.
I'll start off and say a couple of things. So I have 6 staff, and most of them are hourly. So one of the things that I do to support them is offer them flexibility within their scheduling. The the programs that I oversee have the ability to have some flexibility in that. So if they have a longer day, one day they have an event, then they can flex out some time the next day. But also there's times where they have a student that they're working with, and it's been really hard. And they maybe need to take like, a half an hour to just kind of decompress and do something. And so really allowing them some of that discretionary autonomy to do that self-care. My staff also know that I'm really big on if you need to use your APL for like a mental health day, it's totally okay. You don't need to, try to lie and say you're sick when you're not. Like, it's okay to say, like, I need to take this time for myself. And I also encourage them to, especially when the weather is nice, which happens at least, 4 weeks of the year in Michigan. I'm just kidding. But when there's nice weather, I encourage them, take 5 minutes to go out and walk around the block, get out of the office, do something like that, get that vitamin D when it's sunny outside. So those are the few things that I do, especially with my hourly workers. And it's the same with the salary, but with the hourly, we're really trying to get things done in that 40-hour work week and not trying to have it be longer. I do encourage, even though salaried folks can work longer than that, I still try to encourage them to just keep it to that 40.
I know with my employees who are not hourly, I allow for that flexibility in scheduling, right? So,
Oh, Renee, I can't hear you.
oh, you can't hear me? Can you hear me now? No? You can? Yes? Okay. So I will offer them to, move their schedule around, right? So I have some people who drop their kids off at school at 7 o'clock in the morning. So if they want to come into work right after that and have that ability to work earlier but leave, or work, earlier and leave earlier, then that's something that we do. We try and schedule our team so that everyone is able to have that flexibility and no one feels like they have to be there from morning to close every day. I think that's important that as a supervisor, you model some of that behavior too, right? So if you're creating that culture of flexing your schedule is okay, or staying at home for one of your kids' events is okay, then they're going to be more willing to do that for themselves. So I think just creating a culture of that is important.
I can piggyback on that in terms of culture. I mean, we try to start a lot of our team meetings or treatment meetings with check-ins on how staff are doing. Usually we'll have them separate out like home versus work so that we get a sense of like, is it life outside of here or is it life here and work? And then maybe if there's anything they need from their teams that can help them, in that moment, whether it's, my whole caseload is blowing up and I need help with some things, or is it, no, I got it, I'm just stressed out and I just need to like process. That's part of what we try to bring to that. Also, I've been trying to, in a lot of meetings, we try to bring like mindfulness moments so that we can take a minute to be mindful. And like, I'm sure in all of our systems, we're all so busy. It's like one thing to the next, and you just keep going. And so we try to take that, whether it's, a 1 minute, 2 minute, or 10-minute pause to just check in with ourselves on where are we at in this moment. Let's center ourselves. Let's get grounded before we move on to the next thing. Because I think I don't know that our field has always been good at training us to check in with ourselves. We're always putting the needs of those that we serve likely above our own a lot of the time. And so really taking that moment of, where am I at physically? Where am I at mentally? What do I need to do right now for me to be okay? And honoring that and reinforcing that it's okay to honor that, and then move on to whatever it is the next thing that you have to do, because that's how, secondary trauma and burnout is high risk in our, people say it's not if, it's when, but the more you feel like you can check in and be aware of that and honor and allow yourself to feel and move from that, we feel like that will help. It's just another barrier of resilience or another way to create resilience.
I would just add that one of the things that we have realized at National Harm Reduction Coalition, I think part of the work that we've been trying to do is looking at culture and looking at systems, right? And really recognizing that the systems are set up to do exactly what they're doing, which is not to take care of the people that work within them. And that in order for us to do things differently, we need to have different systems. And so how do we start building that and supporting people on the ground that are doing exactly what you're doing, but are working within organizations or within structures that don't support that outside of the confines of the program? And then there's this pressure that somehow you have to conform to this culture of urgency, this culture of white supremacist culture of urgency, of burnout, of leading us to compassion fatigue because workers are perceived as disposable, right? And no human being is disposable. We know that more than anywhere else in harm reduction. So how do we practice harm reduction? How do we center people's needs truly that people feel able to do that? And we've been thinking within MHRC, how do we model that? And we practice that, as difficult as that can be. And one of the things that we've done several things, but one of the things that we've tried to do over the past 2 years, particularly during this pandemic, where you're on Zoom and meetings just blend one into the other, is to schedule either 30 or 45-minute meetings so that you don't have back-to-back meetings, so that you're able to get up, take care of your biological needs, your emotional needs, your physical needs, the need to take time off and not feel guilty taking it off. We closed during the summer for 1 week to observe Juneteenth. It's off, so when you get back, you're at least your email is not blown up because everybody's not emailing each other internally. We have 2 weeks off in December as a holiday break. Everybody gets it off. It's covered, it's paid. You're encouraged to take your vacation time and to make time for that. But during the day also, we have wellness spaces. For some of us, used to be yoga, but many people were like, I'm not down with yoga, but you can still take that time off and take care of yourself throughout the day. And so I think for us, those are things that we're trying to implement systemically within the organization to make sure that if we all observe them, we all also are engaging in community care and caring for each other.
I kind of want to piggyback off of this question because we had a question in the Q&A. And so the question was, as leaders, how do you mirror that self-care and schedule flexibility in your own role? There have been leaders that have said, be flexible and take care of yourself, but the leader works long hours without breaks, and it doesn't necessarily reflect that culture that they're promoting. So how do you do that?
That is a fabulous question. And I know that I have been guilty of do what I say, not what I do. I try to be very mindful of, not sending emails after hours so that I'm not modeling that that's the expectation for staff. When I need a day off, especially my management team, I will tell them, I'm going to take this day off because this is what I need. And so my hope is that then that ripples to them and that they feel that same level of, if I can express that to you, then you can express that to me and feel like you can take that time off or those days off or whatever it is that you need.
Go ahead, Jessica.
I was going to say, I know that I have 2 kiddos, like a 6th grader and a 10th grader. And I'm pretty transparent with my staff because we're small, we're close, we talk about things that are going on in life and whatnot. So I'm pretty transparent with them and say hey, I'm leaving early this day because I need to go do this, or I'm going to come in late to do this, or this is what's going on. So I feel like they get a chance to see that. And then in turn, being able to have a reaction to them that when they do ask for that, the same kind of thing that they need from me, the reaction is one that is really assuring them that this is okay, right? And maybe sometimes almost overboard so that they know, hey, might even be putting a smiley face at the end of the email or whatever, thank you for letting me know, hope everything is well, and then checking in on them about that. But also, I haven't done this yet, but it's something I want to do. One of the people that I work with at Ferris, I appreciate that at the end of her email, her signature says, my work hours may look different than yours. Please do not feel obliged to respond after your working day or something like that, because there are times that, I may need to send something out late in the evening because I was busy doing something earlier. But I think even just having that tagline is saying, I'm giving you permission to not have to work outside. My expectation isn't that you're going to respond to this tonight. And then within my team, because email notifications come up and they can be distracting. We've talked about giving each other permission to turn that off, and then text each other if there's something kind of urgent, like, hey, sent you an email that I need like a prompter response versus like a 24 to 48 hour response. So just kind of modeling those kinds of behaviors as well.
I was going to say one thing that I've been trying to do for the past 2.5 years and I felt has worked for me is to have blocks in my calendar where I have blocks that are meeting blocks that are open. People can schedule meetings there. And then I have blocks that are time to think, to process, to create, to decompress. Because a lot of my work is about visioning, right? And if I don't have the time to vision, then I get overwhelmed, I get anxiety, then I feel I'm not doing my job. And I think that's what, for me, burnout and all this stuff shows up. And so having those blocks and feel that I can have them and people can respect them. And I encourage folks that I supervise to do the same. It's like block time in your day to just sit down and read something that you've been wanting to read related to what you're doing because you want to create something, or you want to meet with someone, or you want to do something that brings you joy, that is connected to your work, that it also gives you the space and the freedom to breathe, right? And to re-energize, which for me during this pandemic has been really important to do. And the other thing, when I used to travel, that I am starting to travel back again physically, was to make sure that those days that I was before and after travel, to really have time to not go into the office, to just like decompress, to recenter, to find, my groove again in terms of the time zone, all of that stuff, because, I wanted to be present. But those things for me, giving myself permission for that, has been really life-changing.
And there is, I think, a difference. And I know Renee and I work together, right? So I understand that, like, the staff that I'm supervising and the programs that I supervise, we are these cost reimbursement programs. So when you talk about like being able to take an hour to do, thinking time, it is more feasible than when you're a fee for service program, like the programs that Renee's working with. And so I always want to be mindful that there's a certain amount of privilege that we have in cost reimbursement versus fee for service programs. So I'm looking forward to hearing too how the fee for service folks continue to take care of each other, because I do know that it looks different or is done in different and creative ways than cost reimbursement.
I also think one thing I wanted to add real quick is, I think especially as a manager, like for us to do our jobs well, we need to know how to recognize the signs of secondary trauma and burnout, and also the behaviors in staff that we know can lead them down that path. And when we see that path happening, like having those conversations about, being worried about, and what do we need to do differently here? Because I think then that makes it talkable. When I say, like, the path that you're on, like, I appreciate you and I love the work that you're doing, and I'm really worried what this is going to do for you in the long run. Like, what can we figure out here? I think opens a door to a conversation, and making it talkable is definitely, I think making talkable is how we make all things, change and be less powerful. So.
And just piggyback on that, what we do as managers, I know I do it, I think Jessica does it as well, is we make that part of our biweekly supervision. We assess for secondary trauma. We talk about ethical, dilemmas that have happened. We talk about boundaries. We talk about these things at least every other week, so that if something does happen and they're not feeling comfortable saying it, I'm opening that door. Like Sarah was saying, I am allowing that space for someone to be able to have those difficult conversations. So hopefully, when something does happen, if the door's open, they're coming in and they're talking about it, and it just makes it normal, right? It, as normal as it can be. So I think that's really important, is as a supervisor, having those brave conversations about things, right? Sometimes we don't want to have those conversations, but if we just continue to do that, then it becomes just, less stressful at work. The last thing I want is for one of my staff to go home and worry about something that happened that day. And I encourage them always, if something happened the day and I'm not there, text me, call me, let's talk about it, because I would rather talk about it now than have it fester overnight.
You guys are already navigating these questions yourselves. You don't even need me here. But let's jump into that further, because that is one of the questions, is how do you identify burnout and how do you balance this through effective management techniques? So what are the signs and symptoms that you're looking for? What to look for in physical, emotional, cognitive, social burnout? And like, what tips can you give the audience for recognizing that within their own staff?
Well, I think part of it is that recognition that burnout or compassion fatigue or whatever word you want to label it with, it doesn't look the same in all people, right? I mean, some people have like physical symptoms of like headaches and stomach aches, or just generally, feeling run down or tired. Some people might have, and it wasn't until I learned this that it was like a light bulb moment for me when they talked about like social burnout, and they were saying, well, like when you get home, do you not want to talk to anyone or like answer phone calls or texts? And I was like, oh my gosh, like I don't want to talk to anybody when I leave the office. I didn't even recognize that that was a sign of like compassion fatigue or burnout. Maybe emotional symptoms, depression, anxiety, just feeling super stressed, your mood all over the place. Or even those cognitive symptoms, like if you notice a shift even in your own or in your staff's thinking, like a staff who normally, maybe it's, thinking changes to very black and white thinking or very rigid thinking, or maybe thinking I'm the only one that can ever do this right and no one's here to help me, or this is never going to change, or people are never going to get better. And like, for someone who that's not how they normally present in their, cognitions, that might be a sign that there's something going on with that. And so I think it's knowing those kind of buckets. And then also I've done exercises in all staff before where I've described each of those buckets. And then back, when we could all be in a room together, I would have people go stand in the corners of like, which one speaks to you? And then, there would always be often a clump of people in the middle who would say, how about all of them? And I'm like, no, that's fine. It's just good to know, because you need to have that insight for yourself. And then as your manager, I need to know how that expresses itself, because then I'll be in the best position to help you if I start to notice those things and I know what to maybe help you to watch out for.
Maybe isolation at work. If you have someone who's the bubbly person that usually goes from office to office to talk to everybody all day, and then all of a sudden their door's shut and they're in their office all day long, isolating, or their paperwork. We see that a lot, because we do a lot of progress notes and a lot of assessments and all of the things. And so if you have someone who before was right on top of their paperwork and now is behind or just doesn't have the energy to do it, we see that sometimes.
One of the things that we're doing as an agency that then is filtering down to the managers, and Renee, if I miss anything, let me know, because you were on this work group, right? The trauma informed care work group that we have. And so as a part of our review process for our staff, we're having them take assessment of sorts and looking at burnout and compassion fatigue, and then being able to talk one-on-one with our staff about those scores. And are there scores in a healthy range, or are they leaning into one side or another, and being able to have that discussion with them about that at that time. So if they don't bring it up in biweekly or monthly supervision sessions, if they're not kind of popping in, and I want to give just a shout out to Renee, because she really, when you say open door, like she really does have such a good open door policy, and I've taken advantage of it myself. So this is a time then where something is on paper. So if they don't feel comfortable bringing forward the conversation, it's kind of structured in a way that it comes to them, right? And it's sort of a planned conversation. They know it's going to happen, which can help to disarm a little bit. They don't feel like they have to bring it up themselves. So we've done it once so far, but that is definitely something that came out of that trauma informed care work group that we have at our agency.
I see someone had commented about having closed doors. We use Teams, which is a pretty cool platform to where you can just call someone and it pops, your face pops up right on the screen. That's really kind of neat. So if you're not with someone, you can leave that option open, and that has been helpful too, to be able to have those conversations, those face-to-face conversations, instead of typing out a quick email. So that's a platform that we use, and it's been helpful just to have more communication and just being able to see someone face to face.
I think for us is also thinking about the impact that the things that are happening not only in our communities with our participants, but also in the world in general, right? Like there's things that are happening right now that we're seeing that are incredibly harmful, right, and difficult to acknowledge, and that we need to think about those in the context of the experience of the people that we work with on the ground, right? And how do you hold space for that? And I think there's a sense of despair that I've noticed that comes up for us in terms of the inability to tap into joy, because our work is beautiful and messy and challenging and hard. And there's a lot of moments of joy and you grasp onto those. But I think with what I've noticed with folks that I work with is that we tend to have a hard time thinking about those because we are feeling just so overwhelmed with this sense of having to figure it out and solve it and fix it, right? Which is also part of white supremacy culture, like this idea of like this, we have to do it all, it's all on us. And we feel really guilty if we can't. And sort of unpacking that and realizing that, we don't have to fix it for people, that we can work with people to figure out ways in which we can do it together as community. And that it is okay to name how we're feeling, as folks were saying. I think that normalization that we've been talking about here is so important, because a lot of times there's a lot of shame and guilt for feeling this way. I think the more that we normalize that, and create safe spaces to have those conversations, I think that makes such a difference. I've seen it at work with us and in communities where we've been working with as well.
The idea that it's okay not to be okay, right? And that if you are having, it doesn't have to just be a day, right? Like it could be 2 days, it could be more than that, right? Like not everything is gonna just snap right back in, and allowing our folks to process whatever that is, because every situation is different, every person is different. So what does that look like for the individual? But normalizing that if you're still okay even if you don't feel okay, right? It's not a wrong thing. Nobody needs to be fixed.
Oh, but we need to empower our staff, though, to let us know if they're not okay too, right? If sometimes we see people coming in at 7 o'clock and leaving at 5, and we're thinking, well, that must be maybe the way they want to work. So empowering them to say, and asking the question, is that really what you want to work? Are those the hours that you want to work? Opening that up so that they're able to say, no, I don't want to work these hours. I just feel like I have to. I think sometimes our staff they're not aware that, hey, it's okay to be honest. And it's okay to say, I've had enough, or this is too much. And as supervisors, remembering that these are our clients too. Our staff are our clients, and we need to make sure that they're all right.
And if you're a supervisor of supervisors, right? If you manage managers, empowering them to be able to be vulnerable with their staff and say, I'm having a bad day, right? Because if our staff are putting us on these pedestals because we believe that we aren't supposed to ever be okay, it's like not okay. So I appreciate having a supervisor that believes in me being able to be vulnerable with my staff, and me being able to say, I'm having an off day, or I don't know, I'm just kind of in a funk. Maybe I need to go to a recovery meeting, or I, need to talk with my sponsor, or whatever that might look like for me. So it is important that, as much as we're talking about how do we care for our staff, that if you are overseeing managers, you also preach that to them too.
I think folks are naming also something that I think is really important, which is that these changes need to be systemic, and we need to look at broader systems, like our programs are the places that nonprofit industrial complex is a product of capitalism. Right, and to oppress, to exploit people, right, and exploit us as workers. And it is about how much you produce and how well you produce, and what you produce, right? Production. A lot of the work that we do is emotional labor that is not only feminized, and there's where sexism comes in, but also invisibilized, right, because of that. And so it's not seen. And so, this idea that somehow the work that we do is never enough, right? And harm reduction is never enough, but also the fact that we're working with human beings. We're not working with machines, right? It takes time, and it takes building a relationship, and whatever you produce, the outcomes, it has to be these numbers, and that can be really frustrating. And I see folks talking about workload and like having, you have to see this many people and you have to do this many things. And how is it that when we are in positions of power and authority, or we have access to those spaces, how can we start creating conversations that we can say, hey, we need to care for our people, because if we care for the people that are offering the services, this will be to the great benefit of the people that we're actually wanting to engage in services. If I'm well and I'm doing my job and I'm happy and I feel supported and satisfied, that is going to show up in the way that I come into relationship with participants and with people in the community, and it'll make us healthier. And I think sometimes those conversations feel really hard to have, but the more that we don't do that, the more the systems will continue to perpetuate themselves. So, I struggle with that all the time. Like, I'm trying to think about ways that we can do that with funders, with structures, with systems. Even at MHRC, we've had like dragged out fights, in terms of having these conversations, because people get defensive. And because we want to do the best that we can do, but also it's like the more that we do the best that we can do, we perpetuate the system, because we're not showing it's not working, right?
So we have a lot of questions coming in, and I have a question, right? So working in harm reduction, we work with individuals with lived experience. And what we know is that there's different methods of recovery. So how do you manage self-care for individuals who may be in long-term recovery and they do need to go to a meeting in the middle of the day, or somebody who comes to you and says, I'm in active use again? So how do you manage those conversations? Because I know, and we hear all the time at the state, is what do we do if somebody's in active use now? We have this peer person or this peer counselor, and you know what I mean? So how do you manage self-care around those individuals? Is it different? Does it look different? Or does it look the same?
Great question. I guess a lot of times it's just a case-by-case basis, and depends on if they're a peer recovery coach, or if they're a counselor, or if they're the office manager, what position do they hold, right? I know personally, if I do have people that are in recovery, and if they say to me, I need to go to a meeting today, okay, go to a meeting today. I need you healthy, right? And so let's see how we can balance the schedule to where you can fit this in your schedule and make it, if you need to go on, your home meeting is at noon on Thursday, let's see how we can balance your schedule that way. If someone is in active use, well, that's, it's a different conversation, and depends on what's going on, and, we follow policies. So we try to help people before it gets to that point, right? So that's really what I have to say about that one. Not a good answer, but the best that I have right now.
I think for us, it's different and it's the same. I think creating space to name what's going on, again, lifting the veil of shame and stigma is really important. And I think when someone is struggling with burnout or compassion fatigue, or just having a hard time at work, really looking at that person in terms of how do we treat someone with the same love, empathy, and compassion that would extend others, and also recognize that their circumstances may be different because of the nature of use and the impact it has on their lives. We have staff that have always been actively using, that are people who use drugs and self-identify as that are employed at MHRC. And we have folks that have named themselves to be in sobriety or abstinent or choosing not to use in this moment. And particularly with COVID, I had a lot of friends and folks that I love and care about come to me and say, Tanaira, I'm freaking out because what's going on, it's blowing my mind. I am really scared, and everything that I've used, all the tools that I had at my disposal to help me be in the place that I'm in right now, not working. And my choice would be not to pick up, and I don't know how to articulate that I may pick up, right? And if I do, what will happen, right? So normalizing that, but also working with someone, harm reduction, right? Is acting, okay, so what would happen if you picked up, what do you think would be the thing that would happen, and how can we work, to support you if that's not your choice right now? But if you indeed did, like, that's not going to make you a better or worse person, right? It's just the reality in that moment, and we can work with you from that place. And
I don't know that this totally answers your question, but I feel it fits. So I'm going to insert it anyways, and we'll go with it. I think also part of this is a little bit shifting the narrative that, like, and be clear, I'm not saying that self-care is not important, because it's not at all the message that I'm sending. But that there's not this magical amount of self-care that we're going to do outside of our work hours that's going to make us bulletproof in the jobs that we do. And I think that's part of a narrative that has sort of been built around the work that we do. Like, if you want to be resilient, if you want to be able to keep doing this work, self-care, self-care, self-care. And if you're really good at it, that's really awesome, right? But if you're not, it just creates like that dialogue of shame and guilt, because, like, I'm not doing the meditating and I'm not doing the breathing, and I know all the things that I need to be doing, but I don't have the time to do them. And so what am I supposed to do about that? And on and on and on, you can spiral down in a place that's probably not going to be very helpful. And so part of what at our agency, we are bringing in a different model, because we've been on the self-care train, and we see that we're still seeing a lot of our staff who, have burnout. I mean, I think in general, people are leaving this field of helping professionals in droves with the pandemic. And we see that everyone, I can't say everyone, that's probably not a fair generalization, but many people are not being more mentally well. They're feeling less mentally well. And so we're bringing in a model that really focuses on, like, that experiential experience of not avoiding feeling what you're feeling. How do you check in with your nervous system about where all of that is at? What do you do with that when you notice that your nervous system is on hyper alert? How do you manage that? What's the narrative that you tell yourself around the work that you do? Because if the narrative and the story that you're crafting in your mind about the work that you do can either support and provide longevity in the work that you do, or, if we go to the basics of our thinking is very powerful, it can also tank us when it comes to the work we do, if the narrative that we're crafting around the work that we do isn't one that's going to support us in continuing to do it. And merging those areas in with the self-care that we do. And so I think that applies to everyone across the board who's in a helping professional, regardless of whatever you might be in recovery from. That it's that blending of self-care with what's the story I tell myself, and that ability to really, like, check in with myself and know, and having people around me that can support me in doing that.
Well, thank you. Awesome. We have some more questions, and I think there's a lot of questions, and I know that you have all talked a lot about creating a space where you can have those open conversations. But what advice do you give to individuals who have upper management who maybe they don't have that space to have those conversations about their burnout experience, about the overwhelming feeling that they're feeling with their caseload, and how do they seek support to advocate for themselves for self-care during the workday?
I have a couple of folks that I work with that I would think of as like my work allies or my work buddies that help me to process things. We really promote and try to model a culture of not gossiping about folks behind their backs, right? But every once in a while, I feel like there's a time you just need to like process something to get the language that could be helpful for you in asserting yourself. Now, I do that with a couple of my work allies, that I call them, or my coworkers, but then also, you know, I have a therapist that I see. And that's something that I do as part of my self-care to help me really process what's going on with me. And then I have my recovery meetings, right? And each of those things kind of come from a different angle and a different lens, but they all help me process to see, okay, what really helping to me to identify, like, what is it that I want? What is it that I want to be asking for? And then coming up with the language to be able to ask for that. And really identifying what is the issue, right? Is it something at home that is seeping into work? Is it work that's seeping into home? Is it the work itself, or is it the amount of work? Is it the population that I'm working with? Is it what is it, just the culture of the agency, and it's not the work? Like, what really is it? Is it just time management and organization that is making me feel burnt out, and placing a system into that? So it can really help to have a system of people that you can trust and that you can process and glean from to be able to articulate when it comes to the time where you need to speak into that with your supervisor, be able to do that. And you've really got a clear vision, rather than going in and kind of just throwing up in the office, and then you're not coming in with a solution or any ideas of what could be helpful for you.
As a supervisor, it is my job to advocate for my staff. And if I see that there's this ongoing theme of compassion fatigue and boundaries being violated and people not wanting to work, I need to go to my directors and say, look, this is what's going on. How can we assist in this? What are some things that we can do as an agency to ensure the safetyness of our staff, or make sure that they're having the best work environment that they can have? And so we have come up with different things, like our Jessica has a what is that? What is your group called? I can't remember now. I want to say
team.
Yeah, take care team, right? And so they do, different things throughout the agency to kind of let people know that you're cared about, that leadership cares about you, that, we want you to be healthy and safe and enjoy work. So, but it's us as supervisors kind of advocating for their needs. And I think that's really important as a supervisor.
And as Renee was saying, I don't know the magic formula for short-staffed organizations who are, just trying to get by every day, for helping them recognize the importance of self-care or of time for staff if they don't already. Is there an advocate on your leadership team that you can approach? Is there data that can help support you in helping people to understand? Is there a champion, that's willing to kind of champion the cause? And sometimes I think it's starting small and thinking small. If we don't have buy-in for, everyone should get an hour a day of self-care time, at work, it might not be at the place that you're at, but like, can you get 5 minutes to be able to go into an office or a room and do some deep breathing? Are there small things that you can do that might take you towards what your ultimate goal might be? If you're not there with your administration in terms of understanding the importance, or necessarily, maybe supporting that if you're not feeling like you have that support. I know right now, I think probably more than ever, everyone is stretched thin with a lack of workforce and the increased demand for probably every service that everyone on this, call works in. And so it is a really tricky balance right now of how do you fit that all in? And, how do you, as a person, if you say, I need 5 minutes to go breathe, like being able to go do that. And I think part of it sometimes is you being okay with that and taking the time to do that, because we're helpers. And so some of us fall to like, I just got to keep going. I have to keep doing more. But when you can, being able to say like, I'm going to take this 5 minutes at my desk or at this picnic table outside and take this breath. And if that's all you can do, that's all you can do. But it's a place to start.
And I don't know if this belongs here or not, but encouraging our staff to take their vacation time, I think is really important, right? And so, I have found that I have staff at the end of the year, they have so much vacation time, they can't even take it. No, take your vacation time. And we talk about it monthly. You have the time, take the time. Go do something fun. Go do something that, even if it's just staying at home, we'll take care of everything else here.
I think that piece of advocacy that folks have sort of addressed is really, really important, because that piece of advocacy means that if we are in positions where we can have conversations with people that are making decisions above us, that we can really name what's happening and the importance of rethinking and revising and reviewing and shifting policies to create a better workplace for everyone. I think that piece is really important. And I see also some things that are coming up in the chat box around feeling like, again, what I think Sarah would say is like, I am being held responsible. Like the responsibility of self-care is put on me. And somehow if I fail, it's my fault, when we're not speaking to the fact that we are embroiled in systems that make it really difficult for that to happen, and make us feel guilty. So I think part of it is, at the place I used to work at before, we had a vacation plan. And literally you looked at your vacation and you said, I'm taking this 2 weeks, and you planned it out. And we planned it out a year ahead so that we were able to know that we were taking vacation and that the stuff would keep going, right? It would keep going. We trusted each other. It was also a smaller org, but at MHRC, we're trying to do the same, right? So I think part of that advocacy too, of saying, yes, these are the things that we believe will make it a better working environment for everybody here, and using that power that we have in those spaces, as Renee and other folks have said. I think that piece is super important if we want to have long-term change, hopefully.
And I appreciate that, like, we have a new committee that's happening at our agency. We're reviewing like policies and procedures and things of that sort. And it's not just our leadership team that is on that. There are staff, frontline staff that are involved in that and reviewing those. And so I believe that is a really important thing to allow them to be brought in and really help speak into changes that can be made at that level as well, and give a perspective that as managers, we don't always have that same perspective. So excited to see where that leads.
So we have some more questions in the Q&A, and it kind of goes along with one of our questions that we came up with, or you guys came up with. What are you hearing from your staff that is most commonly draining to them? So we hear there's been in the chat about the amounts of paperwork, and taking the time off just means that the paperwork will still be there when they come back. And COVID, that has contributed to their compassion fatigue. And so what suggestions do you have to help an employee who is facing this?
I'll speak. Some of the things that I would guess my staff struggle with, specifically with respect to the collegiate recovery programming, and most often when they're first coming in, and they're still fairly new within the last couple of years, but I have some folks that are in recovery, and they're They follow a 12-step pathway of recovery, abstinence-based recovery, and it can be difficult for them to work with folks that are coming from a different pathway than them, and it can be draining. And it is really, we have lots of conversations about how your coaching work is not 12-step work. This is, I mean, that would be against traditions anyways. So it's like, this is not 12-step work. We are meeting students where they're at. We meet with students who don't even meet criteria for substance use disorder. And it takes some work though. If you are coming into, for some of them, it was their first time working in the field and they want to help and they want to give back, but it's been kind of one way for them, right? And so to be opening up and expanding the idea of recovery can look different for different people, and focusing again on what is the goal of the student. In our case, these college students, what are their goals, and us supporting them in that, and being open to those goals changing, whether it's substance use or education or other life domains. And it's been really cool to see the growth, but I would say that can be a real struggle for them, is like, you know, when they're not committed to abstinence, it's like, I don't understand why and what's going on, and can't they see all the things? And so we just continue to have discussions about that as a large group, and then on one-on-one sessions with them as well. The different pathways of recovery and different places people are at and different goals that they want for themselves.
I mean, I think probably, oh, sorry.
No, go ahead. Go ahead. I was going to move on, but if you have something to add, go for it.
I don't know if I do or not. I mean, I think I think our systems might do different things, but it's all the same. There's a ton of paperwork. The red tape doesn't lessen ever. You know, we don't ever get told, here's less paperwork for you to do, or we're changing these things. It's just more. You know, staff get really burnt out from that in combination of trying to prioritize. I think sometimes it's definitely hard to figure out how you prioritize seeing and meeting the needs of the people that you work with, and all of the administrative burdens that often come, you know, from outside our system, just in order to maintain your funding. I mean, we process those things in, you know, supervisions. We try to give feedback where we can. We try to be like, anytime, I know as an agency, like if the state ever asks for feedback on anything, we definitely try to make sure we compose feedback as a way to try to advocate as best that we can, to feel somewhat empowered in a system that we don't necessarily have control over changing. You know, try to, you know, help our staff to prioritize the best that we can, like that there will be things that don't get done, but what are the things that like can be done later, and what are the things that can't be done later, just to try to make it more manageable. I'm not saying that all those things hit the mark, but it's what we try.
I know at times it's just explaining the why, right? Okay, here's this new form. You need to fill it out. So then you're leaving someone with this, why do I need to fill this form out? But actually going, okay, so this is why we have to have this form. And this is the importance. This is what they want to know. And so sometimes it's a little bit easier to do it because I know why I have to do it. It's not because Renee just was sitting up last night and thought, well, this would be a great form for us to start filling out. But just, you know, this is the why, and this is why it needs to be done. And I know it's a lot more work, but once we get used to it, it'll flow better, right? Just being there to encourage them, but then letting them know, you know, wasn't me just thinking this up. There's actually a reason for this madness.
So we have about 5 minutes left, and I don't know if you have been keeping your eye on the chat or the Q&A, but there's been a lot of questions that have come up about PTO, and I don't know if you have any thoughts on that. How do people, you know, how do they manage that? How do they use it for this one thing when they want to, but HR says it has to be used this other way? Or it's unavailable due to certain required policies. PTO towards COVID symptoms. So there's a lot of questions around PTO, and I don't know if you have any specific answers for those questions.
I know that, we have had experiences where staff exhausted their PTO. We call it APL, PTO APL, because of quarantine or symptoms or taking care of somebody else or exposure, all the things, right? So we definitely have had that. I could appreciate that. That our agency has thought of some creative ways of being able to help support our new folks. Like we've had folks that like the first week that they're working with us get COVID, right? And so as a leadership team, we've come together to see are there opportunities to donate APL to those folks who don't have it, and thinking of like, are there some creative ways that we can help to support those folks during these times. But we certainly have had our fair share of folks who, I saw Lydia commented in the chat that, yeah, they didn't have PTO left for a vacation because they had exhausted it with kiddos needing to quarantine from schools and all of that kind of stuff. And yeah, so I sympathize with that. And I don't have a magic solution or anything to add for it.
Yeah, just a second that. I did see the comments and I was like, ooh, I don't know that I have great suggestions for if, your agency policies don't support you needing to take time off in the way that you want to take time off, or having to use it for certain things. I feel that it's made me feel very grateful for the policies that I currently work under because it's very supportive and it doesn't have some of those same restrictions and limitations. And, so I'm sorry, I have no valuable genius insights about how to change administration.
And if I hear it right, it sounds like perhaps they feel that they could do their work from home, but that's not being maybe allowed by their agency. And we do try to find ways for our staff if they're feeling well, right? If they're home and they're sick, then they're sick, right? But if they're feeling well and they just need to be home because of the guidelines that we have around COVID policies, then we try to see what work is doable for them from home remotely so that they don't have to take and use their APL time.
So we have about 2 minutes left, and I want to leave some space for all of you to kind of give some final thoughts, some final advice to people who are working and they may be experiencing burnout, self-care, compassion fatigue, anything like that. So does anybody have any final thoughts that they want to give out?
Want to encourage people to talk to their supervisors about it. At least advocate for yourself, say something, because sometimes you only know what you know, right? And if you think that everyone is working along and everything is fine, then sometimes you don't ask the questions. So talk to your supervisor, advocate for your own needs.
I would add to that to educate yourself, because like I said, I remember sitting in the training where we talked about the different areas of burnout, and the light bulb moment I had when I realized nobody was talking about this, but it was exactly what I had been experiencing. And I was like, holy moly, I have an answer for this now. And so if you don't, if it's something you know less about, educate yourself, because I think the more you know and the more you're able to recognize, the better you will be able to advocate for yourself. And you'll see it more in the other places and might see opportunities for change that you might not have recognized before. So I know no one needs one more thing on your plate, but that's not my intention. But just to be able to know for yourself what those signs and symptoms are, what helps you, what hurts you, and then what your choices are related to that.
And lastly, I would just say really quick that even though we would love for our supervisors to be our best supports, the reality is sometimes your best support isn't your supervisor. And being in that, it may be your therapist, it may be your partner, it may be, it may be your sponsor, it may not be your supervisor. Still finding ways to advocate for yourself, but also finding who your best support is going to be.
I would say organize. We can't forget, the power of finding support with other people that are experiencing the same as us. I think that piece of working together makes this feel less heavy, and we are not alone. And so I do think that for me, yes, organize. And it's not self-care, it's community care. It's like we're caring for a community, we're part of a community. So reframing that for me is also what I would say is a thing that's helped me think about this process differently.
Well, we are at time, and if you guys have a chance to go through the chat and look at all the love you are all getting, just thank yous exploding here and there for what you have said today. We definitely appreciate you coming and talking to the audience and giving them these really valuable tools and words of wisdom. So with that, we move to a break until noon, and then we will have 2 more breakout sessions from 12 to 1. Thank you, everybody.